Coronary insufficiency is basically defined as whenever the coronary blood vessels are compromised, and basically they're going to damage the cardiac tissues in return. So it's the condition that can be quite fatal for a person, and so we're going to basically know the underlying causes for this coronary insufficiency. The main leading cause is, of course, the atherosclerotic lesions that can be found at any level, and even it can be the transmural thrombosis that can basically compromise the coronary vasculature. So basically in this section, we're going to focus on the causes of death whenever this condition of coronary insufficiency occurs. Whenever this vasculature is compromised due to the formation of the thrombus, or it can be any myocarditis or infectious states, any sarcoidosis like conditions, they can basically complicate the situation, and they can be the underlying causes over here. And basically the underlying pathology, whatever is the underlying pathology, whichsoever is basically resulting in the coronary insufficiency, what is the foundation or what is the pathological mechanisms at that level when this insufficiency occurs. So the autopsy findings there are going to be looked for. And that is basically, as a forensic practitioner or an investigator, you're going to basically advocate on those findings that I basically examined the heart of the so-and-so individual, and these were the findings. And on the basis of these findings, I'm going to say that the cause of death was the myocardial infarction, or the cause of death was the coronary insufficiency. So this is basically the whole procedure, why we are following or why we are studying this coronary insufficiency states. The cause of death in the coronary insufficiency, there can be a lot of causes to it, but the severe coronary stenosis can be one of the underlying pathology that can occur. It can be due to the infections, due to the tumorous conditions, due to the thrombus formation itself, but the end result should be the stenosis that is going to basically cause the coronary insufficiency. Then there can be the moderate or minimal coronary atheromas at this level. The post-mortem angiograms, they have to be looked for, and they're carried out at this level. And then the narrowing of the left artery, the left descending artery is basically focused on, and this is the artery basically, if it is damaged, it doesn't give any tributaries or it doesn't give any branches. So there is no collateral circulation that can be basically achieved when such a muscle is damaged. The segmental stenotic irregularities, they're also looked for at this level. And the puckering of the intimal layer, it's again looked for. If it is found that the intimal layer is quite puckered or damaged, it basically indicates that the stenosis has occurred. The atherosclerotic plaques, they are to be looked for. If they're found, they are the direct evidence towards the insufficiency states. It is superimposed spasm that has to be looked for at this level. Now, the non-coronary causes of this coronary insufficiency, they can be the folding of the internal elastic laminars, and the contraction bands, they're again looked for, that are caused due to the damage to the myofibrils, and the lines of Zahn, that is the name given to these contraction bands, and so it has to be looked for at this level. The long-standing stenosis, it has its own factors, and we have to look for them as well. Then we can have the ruptured plaques or the hemorrhagic plaques. Whatever the case is, the subintimal hemorrhages are even diagnosed at the histochemical level. So the slicing of the heart is again very important at the autopsy. These slices have to be sent to the histopathologist, and he's going to comment upon whether he has found these contraction bands, these hemorrhages, these ruptures in the plaques or not. Then we are going to basically the death due to the rhythmical defects. It is going to be highlighted at this level. The ischemia and the hypoxia is basically noted at this level, and the ectopic beats to the atrial fibrillation. If they are found at this level, if there is tachycardia or bradycardia noted at this level, so it is going to basically indicate towards the atrial fibrillation. The left ventricular hypertrophy is one of the findings at the autopsy that is going to indicate that the muscle of the heart was overstressed. So it is again going to basically point out towards the fact that the vasculature or the blood supply to the heart was compromised. So how is this hypertrophy going to be advocated at this level? We're going to note the excess catecholamines and the arrhythmias at this level. The coronary thrombosis is looked for at this level. And At the histological level, we are going to see the necrosis. Now, what kind of necrosis takes place? It's basically the liquefactive necrosis that occurs in the cardiac tissues. So the rupture and the embolism of the coronary vasculature that is looked for at this level, and the fibrosis or some other lesions, they are again looked for at this level. As you can see in the diagram, basically the coronary artery, which is supplying the oxygen to the heart muscle, that is compromised at this level. And in a healthy vasculature, basically these arteries are not compromised, and the blood clot is again damaged. If the hemorrhage occurs in the atherosclerotic plaque, it is again going to complicate the situation by the formation of this blood clot. So that is again going to be a superimposed complication of the already present atherosclerotic plaque. So it is going to further complicate the situation in a particular case. So the complete heart block is one of the complications that can occur at this level. The hypertension is one of the complications that is going to basically ensue into a vicious cycle of renal failure, followed by the ruptured aneurysms, and that is going to eventually cause the cerebral hemorrhages. So it's the vicious cycle. The kidneys, the liver, the brain, all of these vital organs are going to be involved subsequently. The paroxysmal nocturnal dyspnea, it's basically dyspnea that doesn't have any etiology. The person isn't asthmatic, and the person isn't suffering from any respiratory infections, but he still complains of a dyspneic attack that occurs at night. So it is going to basically point out that he has some sort of a cardiac insufficiency from hypertensive left ventricular failure. Hypertension and coronary atheromas takes place, and the concentric hypertrophy of hypertension also occurs after this phenomena. The valvular diseases or cardiomyopathies, whether they are acquired or they are the congenital malformations, the pulmonary edema can take place at this level, and the ischemia of the inner zone of the ventricle wall also occurs at this level. So the cause of death, finally, that we are discussing, what are the underlying pathologies that we have summed up? It's basically the hypoxic changes that occur after this coronary insufficiency, and that is basically going to result in a reduced enzyme activity, which is going to basically finalize in an occurrence of the laminar necrosis phenomena. So the coronary stenosis and the occlusion occurs as we are already commenting upon the fact that there is a coronary insufficiency state. So we'll have a stenosed or occluded coronary arteries, and there'll be a laminar myocardial damage as well. There'll be a severe sustained hypotensive episode of the extracardiac cause. So this is basically going to form the mainstay of death in such a case. So in this section, basically, we summarized how the coronary vasculature can be insufficient or can be compromised in a lot of cases. What are the underlying causes to that? So that is the end to this section. Thank you for watching scardia.com.